Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation, which means I make people look as young as they feel. And today we have a special treat for you. We're going to take a look at a patient journey from start to finish. I'm going to take you through the analysis of what she was concerned with, what I recommended based on her concerns, and finally her healing process and the final outcome. So without further ado, let's break it down. So here you have in her preoperative photo series, we have Nanette. She is 63 years old. She came from Connecticut, all the way from the East Coast, and her primary concerns were those that affect many people during the aging process. She felt that her facial shape was starting to change. She felt that the corners of her eyebrows, the midface, the jawline, and the neck were all starting to sag, creating a lot more unevenness and crepiness in her neck, as well as a jawline that no longer looked firm and tight. And when you look further at the preoperative photographs, you see that she has lost some volume around her temples, her lower eyelids, her upper eyelids, her lips, and even around the bottoms of her jawline. All of those areas normally lose volume during aging, and the concerns become a more gaunt, more deflated looking face. Looking again in the central face on the front view, you can see that the upper lip has gotten a little bit longer and there's excess skin on the lower lip. Upper lip length increase happens as a part of aging because the overall picture is just an increase in the length of the fascia of the overall face. So it follows the same changes that are happening everywhere throughout the face. So in order to address these particular problems, my general approach with facial rejuvenation is comprehensive. That's because everything within the visual frame needs to belong together. You can either look comprehensively older or you should look comprehensively younger, but having a mix of young features and old features usually creates an imbalance or lack of harmony that typically tells us that something has been done surgically. So let's take a look at the procedures that I recommended. So for overall facial shape, which is probably the most important thing to set the foundation, I recommended the vertical restore. The vertical restore addresses the lateral brow, mid-face, jawline, and neck. It brings everything back up into this more youthful orientation. It addresses the neck and gives it that smooth contour, the jawline lifted, mid-face back up into position in that youthful look, and the outer brows back up so you get a more open upper eyelid. So that is the most important single step in the entire facial rejuvenation process, because without it, everything else doesn't really matter enough to make a difference. Now we start breaking it down into the central facial areas. I added volume to her temporal region, upper eyelid region, and I did this through a fat transfer. We added it to the mid-facial region, pre-jowl sulcus, which is this little space here in the bottom, as well as her upper and lower lips. So I used fat transfer to augment and restore the volume that she had lost. The lower eyelid excess skin I removed through a technique that I use called a skin pinch. This is a direct removal of excess lower lid skin, being very careful not to remove too much that would affect lower eyelid position. In the upper lip length, I removed it with a upper lip lift using a bullhorn incision, and that incision was made between the nose and the upper lip, and as a result, makes the scar very difficult to see. As you can see during the recovery process, the first few days are always the most rough looking. People find themselves to look extremely different during these periods, and then very quickly as you go through the different days of recovery, when you get to the day 5 and day 6 and day 7, recovery starts happening very fast, as you can see here. She looks incredibly youthful. Her natural vibrance and youth has come out again, and you look specifically to the areas that I mentioned. Each of those areas have been directly treated with the procedures that were mentioned, and as a result, she has a harmonious and very comprehensive and balanced facial rejuvenation. Now let's hear what she has to say.
I researched Dr. Karam for a long time, and what I absolutely loved about his work, and I really haven't found this, is that there was not one person in his afters that did not look 100% natural and not like you would ever know that they had surgery. They just looked better. And I think this is a very underrated fact, because we're used to plastic surgery as looking like someone had plastic surgery. Better, but you can still tell they were kind of done. There is none of that in his work, and that's what I loved. So when I talked to him and I realized how, sorry, those are my dogs. I realized how thoughtful he was and how comprehensive this whole approach was with the vertical restore and then the a la carte items that you can do. I was totally sold, and I must tell you, this is 2 months, less than 2 months after my surgery. It was fantastic. A week of being kind of laying down and having people, treat you very well. And then I was fine. I mean, I was fine even the first week. I had a vertical restore, obviously, which took 10 years off from the start. Well, 10, what am I saying? It took more like 15, if I'm gonna be honest. I had a fat transfer, which he put in various places, which game changer there. And then I also had the thing with the eye under here, the pinch, which I forgot the name. And I had a laser. I had the lip lift. Lip lift, how could I forget the lip lift? Lip lift is the most incredible invention that I've ever heard of, because it's not filler and you don't have those duck lips. What you have is a shortening of this area, which is really what happens when you get older. Everything just falls. So it's not that you need fuller lips per se, you just need them to lift up and look like they did when you were a little bit younger. It's this space here. It's genius. So I basically had everything. And I must say it was not bad at all. It was an easy recovery. And I think the missing ingredient that most patients have when they decide to have plastic surgery is trust. I trusted him 100% based on his results, based on his methodology, based on what he said, based on his understanding, his time, his patience, his bedside manner, all of these qualities. And the trust, I was completely fine. I said to him, you do what you would do to someone you loved. And you know what? It works. And I think trust is very key in the patient-doctor relationship. And that's what you will have with the right doctor. And I wish I could tell everybody, because there is absolutely no downside. And so worth it. It's worth it. So I love him. Bye.
All right, everyone, I hope you enjoyed that journey. And as always, I'm grateful and so thankful to our patient, Nanette, for being so kind to share her journey with everyone and to let everyone see kind of behind the ropes what healing looks like, what the procedure looks like, and what the final outcome looks like. Without people like Nanette, there would be so much more mystery and difficulty understanding what the process is like. So for all of those patients of mine who've gone out of their way to send photos and share them with all of you, we're forever grateful. And thank you all for paying attention to this video. I think it'll give you a good insight into the process, at least in my practice with the vertical restore and all the things that we do specifically, but also generalizing into the beauty of facial rejuvenation done in a surgical way to address these specific problems. For those of you who haven't already, follow along. We post videos like this at least a couple times a week. So hit subscribe, hit the share button. We want to spread the word and help as many people understand what it takes to look as young as you feel, but more importantly, give people hope that there is an opportunity to do so in a very natural and a very unoperated looking way. And again, thank you all so much. And if you have any questions, drop them down in the comment section. I'll do my best to answer as many of them as I possibly can. All right, everyone, until next time, thank you so much, Dr. Amir Karam.